I want to ask you about the work you've been doing to keep yourself healthy with a guy named George who does this thing called Aqua Stretch. Can you tell me a little bit about that? What that's been like for you?
Yeah, well, it's new to me. I don't know that anybody else. I think it's something that George has developed. I don't know a lot of history about it, but my history with it is that I've been to him 3 times, and I feel for the most part I feel significantly better. Um, he's able to identify and and treat pain just about anywhere it is in your body. Um, My pain hasn't gone away entirely, but it's definitely I definitely noticed a significant improvement. But this all takes place. It's called aqua stretch, and it takes place in the water.
Yeah. How significant is has been your pain, and over what period of time, as you attribute it to Parkinson's? Can you describe what the pain's been like and how long it's been going on?
Well, the the pain is I've had back pain before I had Parkinson's pain. Back pain is a sharp pain, and Parkinson's pain is more of a deep, dull ache. But um it's just as debilitating. It's I don't know which is worse. They're both pretty bad. Well, when the sharp pain is real sharp, that's the worst.
Right, and like you said, that's attributed to other wear and tear on your back previous to Parkinson's.
Yes, yes.
Now, now the dual pain, I've heard that from several Parkinson's patients. Can you describe? I mean, do you know anything about what that's about in the disease that brings about the dull pain? Is it? I mean, why you feel it that way?
No, I mean if there is I you seem to have a little more reference. I guess I haven't talked to that many Parkinson's patients.
Sure, sure. Yeah, yeah. I've heard other Parkinson's patients just talk about it seems like, and this is also an observation, watching their bodies tend to, they either slump or move in ways that they don't have control over. And it's kind of akin to, I guess, sleeping with your head turned the wrong way, sort of thing, but all the time. With you, it's manifested in kind of your back and hip becoming misaligned to some degree. As I remember, Gary Mortensen from Minnesota, his head would lean over to the side. Again, and it just becomes a non-controlled reality. I've seen with you sometimes your arms hang, um, and don't seem to have the dexterity. That was one of the first things you noticed, wasn't it? The lack of dexterity in your fingers.
Well, that's hand, yes.
Yeah. So, but as attributed to, I mean, the shoulder and the arm just kind of hanging. You mentioned, I know before, the difference in your gait, that it's more of a shuffle, that you sometimes drag your leg along rather than step normally, right?
Yes.
So those are, I guess, yeah, observations on my part, seeing the difference in how you respond to your body responds to you, just what's available. And yeah, other Parkinson patients, I've seen them with various similar symptoms, and then talk about exactly what you're saying, which is the dull pain, the dull, deep, achy pain, which I imagine you could tell me it probably gets to the point where it feels it's depressing, at least, if not debilitating.
Yeah, because it's pervasive. There doesn't seem to be any give up to it.
Right. Yeah, it's not like an ache that just gets better. It's just kind of an ache that sits there, right?
Yeah.
Right. So this Aquastretch program, George is a gentleman who I met here at UNLV, University of Nevada, Las Vegas. I'm a graduate student, and he has been developing this program. I just noticed it on a flyer at the Wellness Center, in order to try to get it out on a larger level. He's a homeopath, has been doing this work, not Aquastretch in particular, but homeopathic medicine for at least 30 years now. and he is yeah, just very generous with his time and his study, doing it here. That at least for the first session, he offers it for free to students and family members, which you've been privy to. Um, and he's using this research to try to he's speaking to some very high end political and business community members to try to get this out on a larger level, in various ways. You know, both for people with things like what you have in Parkinson's. Although he told me, interestingly, I was hesitant to even send you in there because he said he hadn't had much success with Parkinsonians. Um, but to, you know, kind of more of a recreational thing for people who are athletes or people who have traveled for long distances. As much of homeopathic medicine is, it's more of an upkeep type of thing usually rather than a cure-all. And since, you know, you have the type Parkinson's type of disease that no one has a cure-all for, it's something that is added to your upkeep ability. Is that right?
Yeah, I would say so. I met last time in there, I met a fella, and it was like looking in a mirror. We were both tilted the same way, that George had been working with, and he was very happy with his results. Um, said, and his wife was happy, who was there also, was also happy with the results. Um, I don't know that it's a cure. I know that it is some relief, and that's good. Um, there's no pain involved in it, and that's real good.
As opposed to Dr. Fang, which we've talked about earlier.
Yeah, George is passionate and aggressive, but he's very sensitive at the same time. Um, he wants to know, he wants to know right away if he's causing a pain. So I really appreciate his approach.
Well, that I agree, and having gone through a couple sessions with him myself, more for, you know, the athletic side of things, where I felt similar to what you're saying, just wonderful release. I get very tight hips when I'm training for marathon or long bike rides, things like that, and have felt the work. That's actually how I met him. Now I remember back. He saw me stretching, I think 2 or 3 days after my half marathon back in December, and just asked me, you know, if I wanted to try out his process. And I had been thinking about it, and I was like, sure, and found it fantastic. I want to go back to something you said that I think it's important not to minimize the importance of the relief of pain. That, you know, many people I think are often, and for good reason, focused on getting the answer to, you know, curing the disease, but perhaps miss out on the steps along the way that can provide for a better and happier lifestyle while you're dealing with and waiting for that cure. And that's kind of where you're at, right?
Exactly. I wished he lived closer to me or I lived closer to him, one or the other. Um, I'd like to see him on a regular basis. I I think that my life would be better.
Do you did you talk to him at all about the possibility of him franchising that direction if he has any ties to the Bay Area?
Oh, he's willing to work with anybody who is a massage therapist or is trained in the field of physical fitness. Um, he's very interested in spreading the word. And he said he has nobody in the Bay Area right now that he's worked with that he's trained.
And maybe that's an avenue you or I can help open for him. Maybe for, you know, semi-selfish reasons, like you say on the one hand, but also I think just in terms of doing a good thing. This is somebody whose work I believe in. A man who I have found similar to you to be passionate and compassionate, and doing work that is valuable. So, you know, perhaps if you might look out and see if there's anybody you can reach out to there in the Bay who does that sort of work, and see if maybe, you know, can kind of connect some dots.
It's a good idea.
Yeah. And I'm working to do the same. We'll be George and I are going to continue to work on spreading the word on his work going forward. So we'll do more with that. Well, Dad, thanks so much for sharing that with us about Aquastretch.
My pleasure.
I love you, and we'll talk again soon.
Love you too. Talk to you later.